Hello, my name is Sean Willis. I'm a physiotherapist at University Hospital, London Health Sciences Centre, and we're going to be going over how to apply a Joy Ultra Sling 2 for the shoulder. Essentially, we'll be seeing most of these slings applied to patients who've undergone sports medicine surgery for rotator cuff repairs, Bankart repairs, Bankart lesions, stabilizations, and also total shoulder patients. The sling basically has multiple components that you need to be aware of when you're looking at applying it. First off is the major component, which is the sling component, where the arm would actually rest to be supported. Beside it you have an abduction pillow, to which the sling is Velcro to. There is the shoulder and neck strap that will be going over the patient's neck to help secure the sling around the individual. But also there is also a waist strap that will be going around the patient's waist and buckling it onto the pillow to make sure that the sling stays in the appropriate position. What we'll be doing is teaching you how to apply this sling to patients so that we can properly fit it to make sure that they're secure when they leave the hospital. With shoulder surgery, it's not uncommon not to be allowed to move the shoulder for a period of anywhere between 2 to 4 weeks after surgery. That has implications in terms of ADLs with dressing and with bathing. With bathing, what we like patients to be able to do is to be able to wash in and around that arm, obviously for sanitary reasons, so for them to feel more comfortable. Because they'll have a limitation not only with being able to move the arm, but also how far they can move the arm, what we'll often recommend in terms of bathing is that they bend over to allow the arm to hang out in front of them, and then they can wash in and around the arm in that manner without having to worry about lifting it. The same would go for dressing. When they're going to get dressed, it'll be very difficult for an individual after surgery to put the arm behind their back or to lift it above their head. So what we also recommend is that they bend forward such that the arm rests down in front of them, and then they dress that surgical arm first all the time. Once they're dressed and finished, they can stand back up without having to worry about moving that arm. With the application of a sling after shoulder surgery, it should always go on over top of the clothing. So a patient should always put sweaters, shirts, that type of stuff on first, and the sling last. So with the application of the sling, a couple of key pointers. We want to make sure that the sling fits comfortably by the patient's side. We want to make sure that the sling isn't forcing the shoulder up and that the patient is reaching for the sling. So it should rest comfortably by their side, and the sling shouldn't be sitting out in front of them such that their arm is across their body. It really should be off to the side, sitting comfortably within the sling itself with the pillow attached to it. When we're putting the sling on, what we want to be looking at is we're going to have the arm bent and into the sling. The pillow, again, should be at a position where it fits comfortably by the patient's side. What we'll do is secure it with the waist belt first, and that will come across. There's a Velcro strap, and we make sure that that is snug and secure. And then we'll bring the shoulder strap over top. And what we'll do is we'll lock that in place, putting it through the tabs along the front. Velcroing it there, and then there's an adjuster strap on the top. And one along the back, and we'll make sure that that is snug. And then one shoulder piece across the forearm to make sure that the shoulder stays snug. And there is a strap here. Often patients ask where it goes. It's not a necessary component. Some people do like it for security and will put it just across their thumb just like that so they can keep the hand secure that way. And as you can see, the shoulder position is good. The arm is by her side. The sling isn't forcing her shoulder up, and she doesn't feel as though she's reaching for the shoulder. She should feel comfortable and snug and supported with the sling the way it is.